Hi, this is Pat Walter from the Resurfacing website, and I'm interviewing Dr. Smet from Belgium, and we're in Baltimore today. Hi, Dr. Smet.
Hello, Pat. Nice to see you again.
Nice to see you. Dr. Smet was my hip resurfacing doctor, and I'm proud of my BHR that I received almost 4 years ago. How many hip resurfacings approximately have you done to date?
Today I've done about 3,200 hip resurfacings, I think.
And normally what devices do you use?
Well, 11 years ago, it's now 11 years ago when I started hip resurfacing. I started with Birmingham hip resurfacing. I'm doing now a randomized study with 9 different resurfacings, where 2 fell already out because I thought they were not doing so well. But today I'm doing mainly the Conserve Plus system because I managed to make better instruments for this prosthesis, and I'm still using some Birminghams for people really in the FDA approval and insurance system for the US patients.
Mm-hmm. What do you think the current trends are in hip resurfacing? Is it becoming more popular? Do you think it's becoming better supported by the medical community?
Well, it depends in which country you are. In some countries, it's leveling off. It stays around 8 to 10% of all the hip procedures they are doing. In the countries they are starting with, it's increasing. But in most of the countries, it stays around 8 to 10%. I must say that the people that started doing resurfacing, they are still doing resurfacing. And they are not slowing down. They see it's well working, the patients are doing well, they don't see too much problems unless you do the procedure badly and then you have bad results, but that's with any system.
Is it always a good suggestion for a patient to look for a doctor that has a lot of experience? Do you think that helps in recovery and the surgery?
The negative things we are hearing today about, and I will say the name pseudotumors they found on the Oxford University in the United Kingdom. Most of the problems we see today and most of the negative talks we hear about resurfacing is mainly because they are badly done. So technique is very important. It's not only technique, you need a good team, scrub nurse, assistant, but also physiotherapy is important. So I don't think that really we are finding some negative things that are away from the technical part. So what I say today, if you need a heart transplant, you go to the cardiovascular surgeon with experience in heart transplants. You don't go to a general surgeon. Today the problem is that often for a resurfacing procedure we go to a general orthopedic surgeon.
Things have been changing a little bit. There are newer devices, they're the mid-head devices, cementless placement, different designs, computer-assisted surgery. What do you see happening in the near future of hip resurfacing?
In the near future of hip resurfacing, I think we will stay with the same prostheses that are already long there and that have proven themselves. That the new things, it's always the same. They start with a new thing, they try it, and they fail, and then they level off. Those that are there, I think we will continue doing them. They will trigger a little bit to the better things if there's a little difference in design. They will become different. Big changes today, I don't think we will have. Navigation, it's not there yet. The mid-head resection has not proven. We have now today 12 years of experience with the longer resurfacings, which like the Conserve and the Birmingham. And I don't know what we could make better today. You have the uncemented head. Maybe it will be better, but for that, the longest experience with the recap is 2 years. Not even with the core mat, it's 7 years, but we are not sure yet if we will have something again that is as good as the things we have today.
Do you think patients should be as concerned about choosing a hip device they think sounds good from their research and reading on the internet, or should they choose a good doctor and let the doctor decide what's probably the best hip device for them?
Yeah, that's always the biggest clue. If you ask the surgeons what would you do, most of them, they would say, okay, I choose my surgeon and he will decide for me. I think it's very important for people that really go for resurfacing, that if they go to a surgeon, that the surgeon always tries to explain the advantages and eventual disadvantages of resurfacing, and that people know very well where they start with.
Could you quickly cover a couple of some of the advantages of hip resurfacing rather than MOMTHR for a younger person?
Well, 11 years ago I started resurfacing because it was bone conservative. You keep bone stock. That means if ever your resurfacing fails, you can do a total hip as a primary. Some people would say yes, but if you have to remove the cup, then you would destroy the pelvis. I've done 90 revisions, not all of myself, but I've done 90 revisions of resurfacing today. If I have to change a cup, it's about 1.4 millimeter bigger. So you stay conservative to the pelvis. So I think the biggest issue still today is that resurfacing is conservative to the bone stock. The second thing where not everybody agrees with, but I still see it like that, is that active people, and certainly people that do impact sports, that have good bone, they do better with resurfacing. Results in osteoarthritis in male patients, they go to 98% in 10 years. You don't have this with a total hip, you don't have that with any other system.
Is there anything special you would like to share about your hip resurfacing experience?
I think the sentence also last months I use a lot is that me doing hip resurfacing, I still sometimes doing 20 cases a week. I would be crazy doing still 20 resurfacings a week if it would not be working well. My practice changed, my incision has become smaller, my soft tissue dissection is smaller. My implant positioning has become better, the instruments are better, so our physiotherapy is better. People get into the swimming pool after 2 days. So I think we still improve, just sometimes with the same procedure, but always trying to make everything work better.
Well, thank you very much. I know many people will watch this and they will learn a lot. Thank you.
Thank you, Pat.